Hey there, viewers! Whether it's sandal season or not, you don't want toenail fungus. Toenail and foot fungus are both common conditions. They generally don't cause much pain. This is why so many people ignore it until the pain sets in. Let's talk about what causes this type of fungus. What can it do? How can you prevent it? How is it treated? We're talking all of that and more. Fungi love dark and damp places, and your feet provide a perfect home to these nasty microbes. Both toenail and foot fungus can be caused by the same organism. But they aren't the same condition, and they're treated differently. So first, you need to know the difference between toenail and foot fungus. Toenail fungus is a fungal infection in the toenail. It happens when a fungus gets in the nail bed from a cut or a break in the nail and penetrates the nail itself. On the other hand, a foot fungus is a fungal infection of the skin, better known as athlete's foot. The fungus enters through cracks in the skin. It's known as athlete's foot because athletes are more at risk due to all the sweating. Kids are also more at risk because they don't often switch shoes. Switching shoes decreases your risk of getting a foot fungus. The fungus could be anything from mold to yeast to other types of fungus. As for the toenail fungus, the nail then continues to grow over the fungus. Once the nail plate is infected with fungus, it will not be infected, and you must wait to see how it grows out and whether the new nail growing behind it is healthy. The new nail rarely grows healthy without treatment. Toenail fungus is more common among older people. The most common reason for toe fungus is constant damage to the nail. Wearing shoes that are too small can hurt the nail and make it more vulnerable to fungus. Also, you may be at a greater risk of toenail fungus if you have diabetes or a weaker immune system. So, it becomes more important to look for signs. When you have toenail fungus, the nail tends to be thick. It's a little bit more brittle and breaks easily. Discoloration of the nails is also very common. It could lead to yellow, brown, or dark white nails. It's not always painful, but it may hurt if the nail gets so thick that it pushes into the skin. So, what are your options for treatment of fungus? If you think you have it, you should see a podiatrist or dermatologist. They'll send a specimen or piece of your nail to a lab. Fungus treatment is different depending on the type. The doctor needs to know which kind you have before anything can be prescribed. Also, sometimes the root of the problem is not a fungus at all. It's another condition. Sometimes it's some kind of trauma to the nail bed. For instance, if you drop something on your toe. There's no treatment for toenail trauma, but removing the nail may be smart if it's hurting too much. If you do have a toenail fungus, your doctor will likely recommend one or more of the following treatment options. The easiest is trimming the nail. A podiatrist usually does this while the patient is on medication. Most of the time, the nail gets so thick that you can't trim it yourself. In this situation, soak your foot in lukewarm water for a while. This will make the nail softer and easier to trim. The next option would be a prescription of a topical medication. These are used the same way you would a nail polish. One of these medications is efinaconazole. This has a success rate of about 50%. It's generally recommended for long-term use. Another similar medication, cyclopyrox, has a 20% success rate. You must use it for 11 to 12 months. If you like painting your toenails with regular nail polish, you won't be able to while you're on these medications. Terbinafine is an oral medication you can take every day for 3 months. It's up to 70% effective, but can have several effects on your liver. If you're at risk of liver disease or taking other meds that are processed through your liver, like cholesterol medication, you can't take it. Itraconazole is another oral medication for toenail fungus. It's 50% effective, and you can take it for 3 months. Removing the infected part of the nail and sometimes the nail completely is another treatment option for toenail fungus. There are 2 ways to do it. First of all, you can do it permanently so it never grows back. The second option is you can take your chances and let it grow back in. Sometimes it grows back in as a healthy nail, and sometimes it grows back with the fungus. If you want to go a little bit fancier, there are laser treatments for your fungus. More research needs to be done to figure out how safe it is, but the FDA has approved several of these lasers. Just make sure you see a doctor before choosing any type of treatment. Now, there are some other home remedies you can go for. The first one is Vicks Vapo Rub. Vicks Vapo Rub is a topical ointment. It's designed to get rid of a cough. Its active ingredient, like camphor and eucalyptus oil, may help treat fungus. A 2011 study found that Vicks Vapo Rub had a positive clinical effect in the treatment of toenail fungus. To use it, you simply need to apply a small amount of Vicks to the affected area. Do this at least once a day. The second home remedy is snake root extract. This is an antifungal made from plants in the sunflower family. A 2008 study showed that the remedy is as effective against toenail fungus as some prescribed medications. In the study, snake root extract was applied to the affected area every third day for the first month, twice a week for the second, and once a week for the third. Number 3 is tea tree oil. This is an essential oil with an antifungal and antiseptic ability. According to a study, tea tree oil might be effective against toenail fungus. To use it, paint the tea tree oil directly onto the affected nail twice daily with a cotton swab. Number 4 is oregano oil. Oregano oil contains thymol. According to a 2016 review, thymol has antifungal and antibacterial properties. To treat toenail fungus, apply the oregano oil to the affected nail twice daily. This is again done with a cotton swab. Some people use oregano and tea tree oil together. The problem is that both products are powerful and may cause irritation or allergic reactions. Combining them may increase this risk. You can also try olive leaf extract. An active substance in this extract is allerapin, which is said to have antifungal, antimicrobial, and immune-boosting abilities. You can apply olive leaf directly to nail fungus or ingest it in capsule form. According to a 2012 review, taking 1 to 3 olive leaf capsules with your meals twice a day is more effective than the physical olive leaf for treating toenail fungus. It's recommended you drink plenty of water while taking this treatment. Easily available in the market as a cosmetic product, ozonized oils can also be very effective in treating your toenails. Ozonized oils are oils like olive or sunflower oil that are injected with ozone gas. According to a 2011 study, this type of ozone exposure can destroy organisms such as fungi, yeast, and bacteria. To treat toenail fungus with ozonized oil, work the oil into the affected toenail twice a day. Again, rub the cotton swab gently over the nail to make sure you're getting the infected area. Another home remedy for fungus can be found in your kitchen. Treating your toenails with vinegar might help. Keep in mind that there's still no physical evidence that vinegar works. Some people have tried it and say it's effective. If you'd like to give it a go, it's pretty safe. To do it, soak your whole foot in 1 part vinegar, 2 parts warm water for up to 20 minutes a day. This next one is pretty popular, as hard as it is to believe. Using Listerine mouthwash is also very popular for fungus. Listerine contains ingredients such as menthol, thymol, and eucalyptus. All of these can work effectively against toe fungus. Supporters of the treatment recommend soaking your whole foot in Listerine for 30 minutes a day. The next one on the list is also found in your kitchen. A 2009 review said that garlic has some antifungal and antimicrobial capabilities. You can treat toenail fungus with garlic by placing chopped or crushed garlic cloves on the affected area for 30 minutes daily. While this seems like it would work, you can also do garlic capsules. The infection can also be controlled and treated by making changes to your diet. The link between diet and health is clear. The healthier the foods you eat, the better the chance your body fights off conditions like toenail fungus. Give your body the nutrients it needs by eating foods that are rich in probiotics, calcium, vitamin D, and fatty acids. Foods with a lot of protein can help your nail regrow a lot quicker. As weird as it is to believe, given what we just talked about, there are some people who ignore their fungus. Instead of going through treatment, they simply put nail polish over the affected area. In most cases, toenail fungus is considered a cosmetic problem. Still, it may cause serious complications for some people. If you have diabetes, toenail fungus may lead to foot ulcers and other foot problems. According to a 2012 study, chronic toenail fungus is a significant risk factor for bacterial cellulitis in your leg. If you have diabetes or a weakened immune system, you shouldn't use home remedies for toenail fungus. Contact your doctor to figure out what you should do. It's so important to take care of your feet. An unhealthy foot can have some serious effects on your overall health. Let's keep the conversation going with a couple more related videos, shall we? Here's what you need to know. Check out 8 things your nails say about your health. Or how about soak your feet in Listerine and see what happens? Go ahead, click one, or better yet, watch both and learn how to take care of your feet better. Have you ever had toenail fungus? Would you consider some of these treatments after watching this video? Let us know in the comments below.